the slight delay in starting the meeting today, but we'll get it kicked off. I am the President and CEO of 1 Million Solutions in Health, and we're here today to learn about attitudes and diabetes. Do they impact one another? So I'm going to introduce our speakers, and then we'll go from there. So if I could just have the control of the screens, that would be great. And thank you all for attending today. So let me tell you a little bit about ourselves, and then we'll move on to the presentation. So at 1 Million Solutions in Health, our goal is to improve healthcare one solution at a time, and we do that by bringing you new information and solutions in the area of life sciences, which would be new medications, new diagnostics, and new medical devices, etc. Also in the area of healthcare, which could deal with things like this, helping you improve your personal health care, or helping physicians or nurses or pharmacists or other healthcare practitioners practice better medicine, and in the area of helping patients and consumers, which again could be considered to be what we're talking about today. So thank you all for attending. At 1 Million Solutions in Health, our goal is to help people connect and to help accelerate research, accelerate usage of new ideas, and accelerate sharing of ideas between patients and consumers. Our goal is to do that through things like webinars, like today's event, live events, discussion forums, articles, etc. And really, if you have some ideas that you would like us to help share around the world, whether you be in academia, government, if you're an entrepreneur or a business, please contact us. We would love to work with you to share your ideas and bring them forward into a global community. So let me give you a brief background about today's talk. So the key to a healthy life with diabetes is to prevent complications that result from the patterns of frequent high, low, and uncontrolled wide swings in blood sugars. Complications are things like complications are rapid in onset in all types of diabetes and can sometimes require additional costly care. We estimate that with the Diabetes Success app, you can achieve up to a 25% reduction in spiraling costs for diabetes care, in contrast with other diabetes apps. People cannot change or modify what they do if they don't see the patterns in their behavior, which are really driven by their choices. So at this company, who's our presenting company today, called Choices and Patterns, they offer a unique, innovative solution that allows you in real time to immediately alert and guide yourself or a person with diabetes, if you're a practitioner, to see, identify, and quickly respond to resolve high and low blood sugars. But today what we're doing is we're going to be talking about how your attitudes and diabetes impact one another and how that can bridge to better care for yourself or your loved ones or for your patients. So let me give you an introduction to today's speaker. Today's speaker is Stacey Dawn, and I'm just going to pull up her bio here and just give you a bit of her background. So Stacey is a member of the Choices and Patterns organization. She's also a licensed clinical psychologist and certified addictions professional with 24 years of experience in addiction medicine, health psychology, and prevention and wellness in the psychosocial model. Her areas of focus include women's issues, stress and disease management, and lifestyle changes. Dr. Dawn earned her doctorate and master's of psychology at Florida Institute of Technology and a Bachelor of Arts in Psychology at the University of Central Florida. She has extensive experience working with National Employee Assistance Programs, critical incident debriefings, and management training, all in this area. Dr. Dawn worked on an NIH grant for women in cardiac rehabilitation and has held academic positions at the University of South Florida and University of Tampa. She is a member of the American Psychological Association and is licensed in Florida. So I'm going to be your moderator for today's session. As I said, my name is Dawn Van Dam. And if you can just take a look at the right-hand side of your screen, you should have a chat box. If you don't have a chat box, go to the very top of your screen and click on the item that says chat, and you'll now see the chat box. So in the chat box, you can put in any questions that you can send to the host and the host will then forward them on to me, and I will ask them to Stacy at the end of her presentation. Also, at the end of the presentation, we will have a chance for you to fill out a questionnaire for us to give us feedback on the presentation and ideas that you'd like us to cover in future webinars through 1 Million Solutions in Health. So, with no further ado, I'm going to ask that we move the presentation ball, or maybe I'll move it myself, to Stacy and make her the presenter. And there you go, Stacy, you're now going to become the presenter. And we're very keen to have you here today to talk to us, Stacy, and let us know more about attitudes and diabetes. Over to you.
Okay, thank you, Dawn, so much. All right, again, I wanted to say thank you to 1 Million Solutions in Health for hosting our webinar today on attitudes and how it affects diabetes. As Dawn mentioned, I am a licensed psychologist and a certified addictions professional with over 20-some years of experience, and I just want to emphasize that I specialize in health psychology and addiction medicine. So with that, let's jump to our slides that all of you, wait a minute.
If you go to the very top, it says attitudes and diabetes. Just click on that next tab, and that's your presentation right there.
Okay.
So it says yes. Quick start event info. There you go. Perfect.
Okay, thank you. Okay, so do they impact one another, our attitudes and diabetes? And one of the things that I want to emphasize today before we jump in is that basically what we are talking about today is, does a person's thought processes or how we think every day in our life affect our health and our behaviors? And I wish that I could see all of you who are on the webinar with me, because I know that I would be hearing a resounding answer of yes. And what's important to emphasize today, though, is thankfully over the past 20 to 30 years, the medical profession and the mental health profession now operate under the assumption that our mind-body is integrated. But it wasn't that long ago, and maybe some of you on the webinar remember this, as do I, that the medical profession very much viewed psychological, psychiatric illness separate from chronic illnesses or anything that had to do with medical. Today, thankfully, we know the two are very integrated. So with that, let's jump to the next, what I want to cover with you in this short period of time is, what are we talking about when we say our attitudes, and does it affect our self-care? If you'll see on the outline that I have up here, especially our self-care in regards to the management of chronic conditions like diabetes, hypertension, cancer, cardiac disease. And then today I'm going to share with you a very simple 5-question inventory about satisfaction with your life, level of contentment. I encourage all of you to take this and be very honest with yourselves with these 5 questions. We'll score it, and then you will begin to see what your score means. And I think for a lot of you, it may surprise you. And then number 3, what we want to cover is 5 strategies or tools to become aware of our attitudes, perceptions, and how we can modify them. So with that, let's jump into our very next slide, which just so we're all on the same page, I want to talk about what do we mean when we use this term over and over again, attitude. And according to Webster's Dictionary, attitude is defined as the manner of acting, feeling, or thinking that shows our disposition, opinion, or the position or posture that we assume in connection with an action, feeling, or mood. Now, right there, those 3 key words are very important. Our attitude affects how we feel and act, okay? Our acting, feeling, and thinking. So the bottom line, as you see, attitudes developed, how are our attitudes developed, and does this affect our behaviors and choices? A lot of us just assume that, of course, we have our ways of thinking, our perceptions, but how is that developed in our lifetime? And surprisingly enough, as you see with the next slide, our genetics determine how we perceive the world to some extent, what level of contentment we have. This is, to some degree, studies and research show us that it is hardwired or genetically predetermined what our temperament is. How we come into the world, what our temperament is, as many of you realize. Do we look at life as the cup is half empty or the cup is half full? And as we all know, we often call that pessimism or optimism. And now we do realize that people who are optimistic are healthier individuals. They have longer lifespans, longevity. Study after study supports this. But the good news is, even if we were born with a temperament that was more of pessimistic, we can learn to be much more optimistic. The other way our attitudes are developed is learned behaviors. What have we observed in our family systems as we developed, especially from infancy to age 6? These formative years were very much a determining factor of how we go through life, the coping skills that we've established, and how we look at situations that we encounter. What was modeled for us? We may have been taught, okay, it's very important for you to be optimistic and not walk around with being angry all the time. But if that's what was modeled for us in the people who raised us, whether that was parents, grandparents, foster parents, many times we learn what we see as opposed to what we're told. Okay, we learn what we see. And that is not to take a position today in blaming those who raised us. They did the best that they knew how. All of us on this webinar who are parents know that raising children is a very difficult job, one of the hardest jobs in life. But learning how to cope more effectively very much affects our health. And then finally, environment. What kind of stressors, early life stressors, did we grow up with? Did we have abuse? Did we have neglect? Did we have a lot of social support systems, encouragement? And we know that this affects our epigenetic gene tags, which can be turned on that could have laid dormant our entire life. It changes the hardwiring in our brain with triggering our limbic system, our amygdala to be in overdrive from a very young age, which then secretes all of the stress hormones, such as cortisol, and very often then results in our frontal cortex having atrophy or shrinkage, which results in us coping less effectively. So the bottom line is, how are our attitudes developed? Genetics, learned behaviors, and environment. Now, we don't want to get stuck in that. We just need to understand the origin of how do we look at life the way we perceive it. And the most important thing I want you to hear me say today is that regardless of what the definition of attitudes are or how we've learned to perceive life the way we've perceived it, the most important thing for you to hear me say today is that our attitudes and thoughts determine our feelings on a daily basis. And every feeling that we have is preceded by a thought. but this happens so rapidly, quickly, that most of us are not aware of what we're even thinking, what we've even said to ourselves that determine our emotions or feelings. And of course, our negative thoughts result in sadness, anger, disgust, and fear. The big one is fear. None of us can escape stress in life. Actually, the only escape from stress in our life is death. And fear is the underlying emotion to stress. So if you walk away today from nothing else from this webinar, please try to remember that fear is the underlying emotion to stress. And if we can remember that, then hopefully the next time we're feeling stressed out, we will say to ourselves, okay, what am I fearful of? What am I afraid of in this moment? And that will help us to right-size it or put it back into a healthier perspective. All right, so as we look at our next slide, the whole basis of cognitive behavior therapy, which is a wonderful treatment modality, still today used extensively in the treatment for the treatment of stress, depression, anxiety disorders. The whole premise of cognitive behavior therapy and cognitive appraisal is that our thoughts determine our feelings and our feelings determine our behaviors, or as Dawn said earlier, our choices. Our thoughts determine our feelings, emotions, and our emotions determine our choices in life, which then, as we've realized, become very habitual or patterns. We have patterns in our behavior, but we'll get to that more in a minute. So what we tell ourselves determine how we feel, and that is a person's resulting attitude. Attitudes determine what choices and decisions we make in our life, such as, do I take care of myself or not? Do I manage my diabetes? Do I eat right? Do I exercise? And the way I like to teach this to my patients is this wonderful ABC model of cognitive behavior therapy developed by Albert Ellis years ago. A is our activating events. B is our beliefs, our thoughts, our cognitions. And C is consequential emotions. B causes C. So A, activating events, are people, places, and things that happen to us all day long that we have no control over. B, our belief systems, our thoughts, our cognitions are what we say to ourselves about A. And then, of course, B determines C. What we say to ourselves creates our emotions and feelings. So let me give you an example of this. Here's an example. A, let's say our activating event is we check our blood sugar, it's elevated. B, automatically we say to ourselves, I can never get this, I can't understand it, I give up, I just don't know how to manage my diabetes and I never will. Resulting emotions are anger, sadness, sense of hopelessness. Okay? We've all been there, whatever our chronic conditions are. Maybe it's activating event obesity, or I'm overweight. I can't get this, I'll never learn the right way to eat. It results in that sense of helplessness or hopelessness. Now, let's scratch through this first example, because today we've learned that our thoughts very much do affect how we feel. Same exact example, we have elevated blood sugar. We could say to ourselves instead, all right, I can learn how to handle this and manage this. I am smart. I know I'm a competent person, and I know that I can get the help that I need. If we say this to ourselves, the resulting emotions are going to be, we are going to feel more empowered and hopeful. Are we going to ever jump for joy because our blood sugar is elevated? Of course not. But in the second scenario, we are going to have lower blood pressure. We're going to feel a sense of more control. And what was the only difference between these two examples? Our activating event was exactly the same thing. The only difference in these two examples was what we said to ourselves. We reframed our thought processes, which resulted in different emotional outcomes. Now, there is one caveat to using cognitive behavior therapy, which will not make it work, and that is if we're not realistic with how we reframe our unhealthy, maladaptive thinking. If we just say to ourselves, okay, my blood sugar's elevated, I can magically think myself out of this, or I can pretend that it doesn't exist, then of course it's not going to work. We have to be truthful and realistic in what we reframe our thoughts to. Now, some people also have a misconception that cognitive behavior therapy, or CBT, is just positive thinking. And the two are very, very different, okay? Cognitive behavior therapy is something much different than positive thinking, because we are realistically reframing our unhealthy, maladaptive thought processes, which result in negative emotions. Okay, hopefully that makes sense. Please hold on to your questions and ask me at the end, because I will be happy to clear up any questions or confusion you have. So to recap, our cognitive behavior therapy modifies our thinking and behaviors. We have to learn to practice it, use realistic thoughts when we reframe our thoughts. It is a very well-researched and valid treatment modality for the intervention of stress, depression, and anxiety. Now, a question may be, why don't more people use it, or why haven't we gotten better at this? And a lot of us do get stuck in the way we were raised, our old sick thinking, I like to say, or maladaptive ways of thinking. And a good example of that is just looking at our perception that we go through life with, of the cup is half empty, the negative, pessimistic thoughts. And again, to rechange this or modify this, we have to first become aware of what we're telling ourselves on a daily basis. And a good way to become aware is to keep a journal or a notebook to begin first and foremost to become aware, what did I just say to myself? Why am I feeling depressed or overwhelmed? What am I saying to myself in the moment? Also, I want to say, before I forget to mention this, there's millions or thousands of wonderful workbooks, books written on cognitive behavior therapy specific to whatever area of life that we're struggling with. If it's on obesity or weight management, if it's on anger issues or the disease of addiction or depression, there are many wonderful workbooks and books on how to do cognitive behavior therapy with those problem areas. Okay, now the next slide that we want to look at is satisfaction with life. There have been many different scales that have been developed. This one happens to be by Dr. Diener, and I would encourage each of you to look at these 5 questions and to simply be honest with yourselves and answer them. There's 5 statements with which we may agree or disagree. Using the 1 to 7 scale below, indicate your agreement with each item by placing the appropriate number in the preceding line to that item. Please be open and honest. This is a very well researched instrument. It's a valid instrument. It has high reliability. It was developed years ago by Dr. Diener. And again, If we look at these 5 questions, we either answer, number 1, strongly disagree, 2, disagree, 3, slightly disagree, 4, neither agree or disagree, 5, slightly agree, 6, agree, 7, strongly disagree. I'm going to give you about 2 minutes to take these 5 questions and then to add up your score. Number 1, in most ways my life is close to ideal. 2, the conditions of my life are excellent. 3, I am satisfied with life. 4, so far I have gotten the important things I want in life. 5, if I could live my life over, I would change almost nothing. Please take a minute to answer those 5 questions and add up your score. I think some of us may be surprised with what our score is, so let's look. If we scored in the range of 30 to 35, this is high satisfaction with our life. Again, people who score in this range love their lives, feel that things are going very well. Their lives are not perfect, but they feel that things are about as good as lives get. Just because the person is satisfied doesn't mean that they're complacent. Growth and challenge might be a part of the reason the respondent is satisfied. And for most of us in this range, life is enjoyable and the major areas of our life are going well, such as work, school, family, friends, and our personal lives. Now, if we scored in the range of 25 to 29, it still indicates high satisfaction, and those of us in this range tend to like our lives, feel that things are going well. Our lives are not perfect, but we feel that things are mostly good. And again, doesn't mean that we're complacent. Growth and challenge might be a part of why we are satisfied. And most of us in this range are enjoying life, and the areas in our life are going pretty well, okay? And we may be motivated because of some things that are dissatisfying. So now let's jump to the third range, which is between 20 to 24, and this is the average range. Many people score in this range, but the majority of people who score in this range have areas where they'd like to see some improvement, and some of us in this range are satisfied with most of the areas in our life, but we may have 1 or 2 places where we'd like to see some improvements. So scoring between 20 and 24 is a very normal area or score, and it indicates that there's areas that need improvement and that we'd like to move to a higher level by making some changes in our lives. So this is good. This gives us insight. Now, 15 to 19 indicates slightly below average with our satisfaction in life, and many of us in this range have some significant problems in some areas of our life and areas where we may be doing fine, or we may just have one area that's a substantial problem for us. If we've moved into this level of satisfaction from a higher level because of recent things, then it indicates that we'll probably move back up. But if we're chronically slightly dissatisfied with many areas of our life, then it means that we may need to make some changes. So what's important with this scale is not to be frightened by this, but to say to ourselves, okay, good, this validates for me what I've been thinking and feeling, and let me look at the areas of my life that I need to make some changes in. A chronic level of dissatisfaction across a number of areas of life calls for some reflection, as we just said. And so dissatisfaction across a number of life domains is many times distraction for us and gives us results this unpleasant feeling. Okay, finally, when we go to the 10 to 14 range, it indicates dissatisfaction in our life, and 5 to 9, extremely dissatisfied. Now, these two classifications are validating for us that we're not feeling satisfied or content in certain areas of our life, and both of these two ranges also suggest to us that maybe we need to ask for help, and that's okay. Asking for help, which many of us throughout our lifetimes have sought professional assistance or talking to a friend or someone we respect, indicates a level of healthiness, knowing that I have some areas that need work, and this doesn't indicate a deficit. It indicates that I need to get the help that I need. So 10 to 14, people who score in this range, substantially dissatisfied with their life. We may have a number of areas that are not going well, or one or two that are going significantly bad. And it could be bereavement, divorce, problems at work, and we may return to a higher level of functioning. But as we said, during this phase, we need to get the help that we need from a professional, a friend, clergy, whatever it may be. And then 5 to 9 range, extremely dissatisfied. Again, we're extremely unhappy in our current life with one or two areas. So the reason that I wanted to share this with you today, our life satisfaction scale, is that we know that people who have, we all have our ups and downs as we go through life events, but it is very important, and study after study shows us now, that what our baseline is predicts how resistant we are to depression, anxiety, and stress. And if our baseline satisfaction with life is healthy or optimistic, positive, if we have a level of contentment, we're going to be less prone to dip into depression, anxiety, or increased stress levels. Okay, now our next slide emphasizes to us healthy eating, which we all have heard, but I love this quote that I recently came across. Dinner does not, this is the, that's not supposed to say dinner. It's supposed to say DNA does not determine our destiny, dinner does. So those of you on the call, please make a note of this. The quote from our Dr. Katz from Yale University Prevention is, DNA does not determine your destiny, dinner does, okay, DNA. And what the research is showing us is that unprocessed foods and mostly plant-based diets are the best diet for our health, our longevity, and our mental, psychological functioning. And where do we find most of the diets such as this is the Mediterranean diets. So eating less animal protein, more of a plant-based diet such as vegetables, fruits, nuts, beans, tofu, salads, whole grains, lowers our risk for diabetes, heart disease, obesity, and cancer. And people who eat unprocessed whole foods, mostly plant-based, results in more energy, we feel better, we're happier, healthier, and the great side of this is it almost is immediate, how we begin to feel different. So again, the quote is, DNA does not determine your destiny, dinner does, by Dr. Katz. Okay, our next slide. Exercise, yoga, meditation, mindfulness. Yes, I know we've heard about exercise for years and years, but what I like to emphasize is the latest research now tells us even breaking it into 3 10-minute intervals, 10 minutes in the morning, 10 minutes afternoon, 10 minutes evening, that counts for 30 minutes of cardiovascular, what we need 3 times a week. Now, the latest research says 5 times a week, but the most important point is to put it into our daily routine and schedule it, or we don't do it, as we all know. And I like to give the example to my patients, do we ask ourselves every day, should I brush my teeth? Well, of course not. We just do it. We put it in our routine, thank God. And this is what we have to do with exercise. The latest research now says if we do it first thing in the morning before we eat, it revs our metabolism for the entire day, and we've gotten it out of the way, gives us energy. And the other very important point today with exercise is find what works for you. Running, marathons is not for everyone, whether it's walking, jumping rope, bicycling, swimming, going to jazzercise or a gym. The important point is finding what works for you and taking it at the pace our body can tolerate. Mindfulness, meditation, becoming aware of the present moment is critical. Study after study shows us that yoga, meditation, mindfulness is a form of relaxation. It puts our body into parasympathetic mode, which is a relaxed state, which gets us out of sympathetic arousal, which is fight or flight, okay? And that's fear. If we are in a relaxed state, meditative, mindful, such as yoga, Tai Chi, or just simply deep breathing, then we're not pumping all those stress hormones, such as cortisol, through our body and creating or increasing our risk for disease like diabetes. So the hallmark or foundation of meditation, relaxation, mindfulness is to learn how to do deep breathing, and we do this by inhaling to a count of 2, exhaling, which is the most important point, to a count of 4. Inhale through our nose to a count of 2, exhale through our mouth to a count of 4, very, very slowly. And finally, the last slide I want to share with you today, studies have shown us through the Cerebral Cortex Journal, people who do yoga have 5% more gray matter in our brain regions related to the ability to pay attention, increased ability to process information and regulate our pain compared to those who don't engage in the practice of yoga or meditation, which is a form of relaxation. So with that, again, well, let me recap something very quickly. The 5 tools or strategies to manage our diabetes. Number 1, becoming aware of our thoughts, learning how to reframe our thinking. Number 2, awareness of what we're putting into our mouth daily. Log it, write it down, move our body. Oh gosh. By a pedometer, are we getting 10,000 steps a day? Exercise in some way, shape, or manner. Number 5, find a form of relaxation, meditation, mindfulness, and do our deep breathing. And again, to recap, thank you for being here today, and our wonderful quote, which I love quotes, if I am not for myself, who will be for me? But if I am only for myself, what am I? If I am not for myself, who will be for me? And this is critical. I think so many of us who have our chronic conditions really don't take the time to take care of ourselves. So with that, Dawn, let me throw it back to you for if there's any questions. I know we have about 15 minutes remaining.
Great. Well, thanks, Stacy. That was a fabulous presentation. And I know for me personally, I always like checklists and, things for me to understand where I'm at. And I know that, sometimes in our lives we can think that we're not very stressed, but when we actually sit down and realize what we've gone through, maybe you just moved, or maybe you changed a job, or maybe you did both, you're actually more stressed than you thought. And to give yourself that little breather and that time to give yourself permission to relax, do some yoga. Some breathing is often very important. So thank you for that.
Thank you.
So yeah, we're going to take questions now. So again, just a reminder is please put your questions in the chat box. If you don't see the chat box, it's usually on the right-hand column, or in the right-hand column, in the middle of the right-hand column. If you don't see it, go to the very top of the right-hand column, and you'll see a little icon called chat, and you can click on that, and you'll be able to put questions in the chat box. So it just says send to host or send to, so just choose send to host, and then you can send them, and I'll be able to answer them or ask them to Stacy, and then she'll be able to answer them. Great. So thanks, everyone. Just another reminder, too, is we will have a survey going up in a minute, and we would love you to fill that out and give us your feedback on this presentation and what you'd love to see in future presentations. So, Stacy, let me start with the first question I've received from the audience today. So why do people resist, behavioral therapy or learning this behavioral therapy if it is well-researched and a proven treatment with such successful outcomes like you've mentioned?
Okay. Many times, that's a great question, Dawn. In our country especially, people, as I mentioned, we grow up, we're taught a specific way to think in our family systems. Sometimes it's cultural. I'll give you a great example. One of the ways that was ingrained in my belief system with my family was a lot of shoulds, shoulding, what we call these is maladaptive thinking or cognitive distortions. And when we should ourselves all the time, I should get all my work done before I relax. Well, as most of us know, we can never get all of our work done. So even to this day in my adult body, I have to work on this maladaptive, irrational thought process and say to myself, Stacy, it is okay to play. You deserve some time for yourself. So many times we stay stuck, even though we know this is a very valid treatment intervention because of the way we've been raised and learned to think. Another answer to that is most Americans, a lot of us just want a quick fix. This takes practice. We have to learn this treatment modality, practice it, and then it will become automatic in our thought processes. Okay, but many times we don't want to work on that. We just want, number one, humans don't like change. We're resistant to change, and other times we'll say, well, let me have a quick fix, like I'll just take a drink or I'll pop a pill. So we tend to self-medicate. And then finally, a third answer to that is it's very difficult for some of us to adopt the strategies that we've discussed today if we struggle with clinical depression or anxiety disorders. And so it makes it even 10 times harder if we're struggling with a psychiatric diagnosis. Does that help to answer? Yeah? Yeah,
that's great. Thanks, Stacy. I'm going to actually just share my desktop because we have a really great question here. And you've talked a lot about the attitudes in diabetes, but you haven't mentioned the solution that comes from My Diabetes Success and the app there. So I've just put it up on my screen. Hopefully everyone can see it. Can you see it, Stacy?
Yes, yes.
And so can you tell us how this tool, in looking at the patterns that come out of this tool, can be aligned with the conversation that you just discussed today?
Right. The wonderful thing about the app that My Diabetes Success has developed is that it really helps us determine what are the patterns in our behaviors that we always tend to go back to. And when we can see, it's almost magical, when we can begin to see these patterns in our behaviors, we astonish ourselves. And that's why I encourage, as I've said throughout today, to keep a log, keep a journal. Well, the app is a way of basically doing that because it's logging our behaviors for us and showing us like a light bulb going off. Oh my goodness, this is my pattern. So obviously I keep going back to these unhealthy, maladaptive choices. And then with this enlightenment or education, it can help us then modify our behaviors. And as you said many times, Dawn, we're oblivious to the things that we do day in and day out. We almost just do these things automatically. So by having the app show us what are the patterns in our behavior, these are the choices I always go back to, let me learn then the different choices to make to help control my blood sugar in a more effective manner.
Okay, so what type of information does the app collect for people?
Well, as we are putting in what we're eating, then it gives us the visual display and the information to read of where our blood sugar is, and it's showing us how dramatically exercise impacts our blood sugar, the foods that we eat, how it impacts our blood sugar, and can help us maintain a steady, safe range of blood sugar for longer periods of time.
So are you just putting in food into the app, or are you putting in other information as well?
Other information as well. And again, I know you're a little bit familiar with it. You can maybe add to that. But it also is when we put in the time span, how much sleep we've had, how much exercise we've had, all of these factors together play a part in maintaining our blood sugar ranges.
Okay, great. Well, thanks for that, Stacy. Appreciate the question from the audience as well, too. So can you see the speakers now again, your picture up there?
Oh, yes, and it looks like a question is, where is the app? Is that one of our questions?
Yep, that is.
Okay. So, Dawn, you can tell them better than I probably the exact website, or it's www. Yeah.
Yeah, so I can put it into the chat box, but it's, as Stacey said, www.my-diabetes-success.com, or you can search for it on the iPhone or on iTunes, whatever, the iStore, sorry. And it is a free app, so you don't have to pay for it. You can just try it out and download it and get it from there. So we'll stick it in the chat box as well. So Stacey, here's another question for you. What is the best way in which the 5 actions that you talked about could be executed, considering how healthcare is delivered? That's a pretty big question. I don't know if you have any thoughts about that.
Okay, that's a good question. Can you repeat it one more time?
Sure. What is the best way in which the 5 actions should be executed, considering how healthcare is delivered?
Okay. Well, as far as healthcare being delivered and how can we integrate these 5 actions, that is one of the beautiful or great things about our access to information today with the internet and all of the great articles that are published, information we can get about any of these specific areas we discussed, like if we want more information on exercise or foods that we consume, we can research it ourselves, or we can work as a team with our healthcare system. Now, I know ideally that sounds better than what reality often is, but working in the healthcare system, I will say that if we work at it hard enough, and sometimes it is a struggle, but we can eventually, if we do enough legwork and research on our own, we can find a nurse practitioner, we can find a physician who is internal medicine, endocrinology, holistically trained, whatever, who really has the same interest areas that we do, and they will start to work with us as a team. Is it easy? No, it's not going to be easy, but the onus does fall back on us to do the legwork and really keep searching, but there's enough healthcare practitioners and groups out there that we can find one. Does
okay, great. Yep, that's very helpful. So here's another question. Why do people not eat healthy, especially when we have study after study proving the effectiveness of the benefits of changing our diets?
Okay. Number one, again, I said, if we're struggling with clinical depression, which could be a whole nother webinar for us, or anxiety disorders or high levels of stress, of course, it's quicker and easier to eat whatever's available. And in our culture, it is more expensive to try to eat healthier, as we all know. If we're going to go to the grocery store and try to buy organic foods, organic fruits, vegetables, of course, even and it's so convenient to just zip in through the fast food, okay? And then even if we order a salad through the fast food, if we drench it with a whole bunch of ranch dressing, that's going to kind of even, you know, counteract what we're doing here. So the bottom line is we have to really work at it and be diligent and determined, but I hope everyone will hear what I said earlier. The payoff comes very quickly. And I'm the world's worst. I mean, I'm not a great cook. I don't like to cook, so I want what's fast and convenient. But when I eat correctly and the healthier food choices, I have more energy. I feel more awake and clear-headed. Does that make sense?
Yep, certainly does. Okay. Another question that's come in is, what role does depression have in how it affects our health or lifestyle?
Huge. Okay, when we struggle with depression, how it affects our lifestyle is many, many times we know multitude of factors. Our endocrine system, our immune system is compromised. Many times we self-medicate with alcohol, cigarettes, food, because we're struggling day in and day out. We aren't getting off the couch or out of the bed to exercise. All of the things, strategies we talked about today to manage our chronic conditions are harder to do when we're also have a comorbidity of a condition such as depression or anxiety disorders like panic attacks. But the take-home message with that is, if we have a comorbid condition, we need to also get the help that we need with that. If we need to be on an antidepressant, we do it. If we need therapy, we do it. And at the end of the day, the exercise and the eating right is going to decrease the depression as well as improve the management of our diabetes. Does that answer the question?
Okay, thanks, Stacy.
Sure.
Yep, that was great. Great, thank you. So just a reminder to everyone that the survey is in the chat box. If you could just click on that link and answer the few short questions, we would really, really appreciate it. Also, just a reminder, if anyone has any additional questions right now, to stick those in the chat box. And if not, I'm going to ask you the last question now, Stacy. And just, again, so thinking about the things that are in, that are collected in this app from My Diabetes Success, so things like the exercise that you do and the food that you eat and the medication that you take, and then you talked about the patterns that it shows you. How do you think this will impact people being more compliant or changing their behavior or you know, making better choices?
I think that if it could increase compliance and really be a wonderful tool, because if we feel like we have something that is helping us in a way of communicating with what's going on internally in our body, again, we feel that sense of control and empowerment. And when we have that, then we feel less helpless and depressed. So, and I think that is the biggest key we see with depression and a sense of unmanageability when it comes to chronic conditions. Even obesity, you know, not knowing what should I eat and what shouldn't I eat. When we have a vehicle that gives us this information, it's going to increase compliance.
Great, excellent. Well, thank you so much for this very informative and interesting presentation to Stacy today. This is, again, Dr. Stacy Dawn, and also she talked today about how you can look at your attitudes and diabetes, and also she spoke about the app that's available through My Diabetes Success, and hopefully some of you will take advantage and take a look at that, and we'll welcome Stacy to come back again for a future talk. So thank you, Stacy.
Thank you, Dawn. Take care. All right?
Okay.
And thank you, everybody, for being on. Take care. Bye-bye.
Bye now.